Right now, there are thousands of drug-addicted West Virginians in what are called MAT programs, which stands for Medication-Assisted Treatment, more commonly known as Suboxone treatment.
There are 71 of those clinics across the state, regulated by the Department of Health and Human Resources. But some clinics are now accused of exploiting their patients. 13 News reporter Alyssa Meisner has this exclusive report.
When addicts walk into a Suboxone or methadone clinic, they're trying to get clean and get their lives back on track. But some are finding they just can't afford it. Elizabeth Crawford has been a counselor for 25 years. She was excited when Dr. Anwar Abdeen offered her a job at his Suboxone clinic, Absolute Care.
I felt like I was getting through to them. The patients loved me and I loved them. They would tell me that they felt like no one cared about them until I came.
But on Crawford's first day, a patient said she was concerned about the cost of required counseling.
She said, I just paid you $300. And I said, I beg your pardon. She said, well, I'm broke. I don't have any more money. I just paid you $300.
Crawford thought her patient was confused, but as the weeks went on, other patients said the same thing. Crawford connected us with other patients who were too scared to show their faces on camera. Most are on Medicaid, and it's being billed every month, but they said they still have to pay cash up front. The website for West Virginia's Medicaid program says MAT treatment is covered, so we confronted the Absolute Care Clinic.
I have a camel person who's standing in front of your office, getting ready to fill your building with an expose that's going to hit the news this evening about insurance fraud going on in your clinic.
That was the office manager at Absolute Care, where Crawford used to work, talking to Dr. Abdeen, who has refused repeated requests for interviews or even comments. Is there anything you'd want our viewers to know about what's going on here? Crawford says her patients also reported double billing at Solutions Recovery in Williamson. Though no one responded to our repeated calls for an interview, a viewer shared this phone call recorded last week.
We charge $350 a month for our clinic. Is that going to be a problem for you? The insurance will pay for your medicine,
Okay,
and it will pay for the doctor visit. We still require a $350 fee for the counseling and the drug testing.
The Office of Health Facility Licensure and Certification, in charge of overseeing these clinics, told us about cash payments, saying a clinic can only accept payment if the patient's record documents insurance coverage was denied, if the patient doesn't have insurance, or if the patient refuses to allow the clinic to bill insurance. Crawford says many patients are on a fixed income or work minimum wage jobs. She's heard dozens of heartbreaking stories from patients.
People have gone there, they've trusted the clinic, they trust me, and they've been betrayed. They've been betrayed big time.
Crawford says she's reached out to the DHHR's Inspector General, the U.S. Attorney's Office, and Governor's Office, but these clinics remain open, and she's concerned it's happening at other clinics as well. Reporting in Charleston, Alyssa Meisner, 13 News, working for you.
A spokeswoman for West Virginia's Medicaid program says everything from the doctor visit to evaluation to counseling to drug testing and medication are all covered and reimbursed through West Virginia Medicaid. We'll be continuing to follow this story. If you are a patient in the meantime at a clinic where you believe you're being charged twice for services, send us an email or a message.